qualified just because of his heart of compassion.
Correct. And you know, I can see that happening, you know, going out and doing it on your own. Medicine, anything medically related, it has to be a vocation. I mean, you got to have people that really like what they're doing and have passion for it, to undergo all the hard hours and all that stuff, and all the, you know, my family not seeing me and things like that. And on top of that, you're going to have to be a little soldier and follow the rules and regulations of medicine. Come on. I saw this coming even from the private sector type medicine. In many ways, the insurance companies became, you know, like the government, a very monolithic type thing where they would dictate what you could do and what you couldn't do. And you started seeing this coming as the, what's that book? The book, the Clinical Outcomes book, which is very nice, and I think that's a great idea as guidelines, but not as a, you know, end all. And that's what I'm beginning to see. Because if you don't comply with that, if it really gets to be a regimented thing like Obamacare, you're going to get...
But the government... Oh, I'm sorry.
Well, that's okay. So people, many people across America think, well, this is going to be a great thing because it's going to be free health care. But what they don't stop and think is that it's going to be an influx of people with government regulation, and so they're really not going to get better care than what they get now.
You're not going to get what you expect.
No, and the people who have the money will get whatever they want, no matter what. So that's not like, you know, the ruling class in Washington will get their health care like they get it now, and no problem. But for us, the rest of us, it's going to be another standard, and that nobody's going to like. And my biggest fear is that if this machine starts going on, there is no way of turning back, because you're not going to invent or create out of thin air physicians and all. So, you know, so when we don't like it, we go, you know, we go back to what it was before. I don't know.
You can't do that once it's implemented.
So there's another point that's interesting, is that we have a good, about 20%, I think, of the doctors in the United States are foreign.
I was just getting ready to ask that, because Pilar and I had this
foreign doctors. I mean, I studied in a foreign school. Now, if you start making it a little bit less savory to become a doctor, on top of the scarcity of doctors that is coming out of the medical schools we have here, those are the people who stay home in, you know, and do their medicine at home, because it's not going to be much better here. So we're going to have, the poor nurses are going to end up being expensive.
The new doctors.
And I can see it coming now, where the nurses will do the outpatient and the doctors will be the hospitalists. In many, you know.
Well, we see a trend towards, and
we're seeing it now.
I mean, we see a trend towards additional responsibilities on the registered nurse as it is.
Right.
And there's a big push for nurse practitioners and physician's assistants. And not to discredit their abilities, but they don't take the place of skilled, trained physicians. And I still think that when the government's paying the bill, they're going to pay the cheapest person.
Sure.
And those responsibilities on that nurse practitioner, on that physician assistant, we're going to open up the things that they're allowed to do under this Obamacare to the detriment of the patients.
Well, when I was a pediatrician in Fort Stewart, they made the mistake of putting only 3 pediatricians for a population of childbearing age 17,000 doctors. Okay.
Wow.
So we ended up being really a mess. So they brought out this special program called PAMOS system, PMOS. I don't remember what it meant, but it was a decision tree, sort of like the the clinical outcomes thing, where the corpsman, who had very little idea of what the whole medical thing is, not even the nurse, the corpsman would sit down and just go, hey, coughing? Yes, okay. It was an utter failure, okay? And because it took away the reasoning from it, it took away the art of it, actually. I'm even seeing that with the electronic medical records, where I had, for example, I had girls that would faint, okay? And I started seeing a trend, hey, this is the age and all this. I wonder if, you know, the first, you know, if
Something in
if there's
common
a
with
bill
all
or
of them.
whatever, what's in common. So I go to the electronic medical system, I try to find out, okay, let me do database, of course, simplest computer
Sure.
thing. No, it couldn't do it. It could not get me how many girls, ages, through, but they could really tell me to the dot how much money they owe.
Wow. So,
So-
the care was pushed aside in order to make sure you got your dollars, or the
Correct.
system got their dollars.
And it looked good. No, even worse, that it looked good in the bureaucratic way.
Right.
You had all your I's dotted and all this, so, you know, if something
Yeah.
happened, you're safe.
Good.
CYA.
The worst thing, I mean, it's like, whoa, a nightmare to think that this is going to be a bureaucracy like I lived it for 20 years, and how frustrating it was everything, and nobody
What
is
was-
responsible for anything.
What was it like for and I use geriatric loosely because, you know,
Yeah.
what was it like for
Almost
this?
there.
I know. It's closer every day. But what was it like for the 65 and older population?
It was wonderful. Because, see, for the old people, I mean, you didn't, really the people who need the care, they don't get it. Because usually the sickest is the people who are young or fairly young, and when there is something wrong, usually it's serious. So those people, they will decide, I'm not going to lose my day of going to work today. I cannot afford it. I'm not going to spend the day in the doctor's office. So they don't go, and many times they go when it's too late. Now, for the people who are retired, they don't have nothing to do. So it's kind of a socializing place to go.
Really?
Really?
Yes, it's wonderful.
But they
They
have
compare, you are
phones.
waiting in the waiting room, there is a lot of people
Yeah.
there, you compare your boo-boos, and then, yeah, I mean, and I'm not trying to make fun of people who really are sick, but it was a way of, you know, senior citizens to
So
socialize.
the rationing of care,
So then-
that we're concerned with, we're concerned about the rationing of care in the seniors won't get what they need, but your experience
Well,
is...
and then, I'm going to show you another. This is when, you know, kind of a place of socializing, and
But they
But
get in there and
then-
they say, oh, sorry, I
oh,
can't treat
and I'm
you.
going to tell you the
the
emergency
hospice.
room. My mother, when she was really sick, it will go that we'll get in her case. They say, "Mom, why did you go to the emergency room? You had to go to your doctor because, you know, it has abuse in it." Well, you know, because they look at me better, they do all the tests, and I don't have to wait.
Wow.
So, you know, you get better care in the emergency room, and faster and better. And if she had to go to there because she didn't like to socialize,
In their,
then, but then another thing, when the doctors are bombarded by people who, well, you know, my
So what
neck,
happens when the real emergency comes in?
oh, good luck. It's between
Wow.
you
People are
and
getting
God.
the free
Pretty
milk.
much, it's between
yeah.
you and God,
But-
and you need to be lucky in
Yeah.
that way
now,
because,
the thing is that they don't get the best care in the emergency room. That's what people think because they get it right away. And,
Right.
you know,
yeah, they get the result. That's what people
and they don't
want.
get the whole thing. 'Cause,
No, they don't, but at least they get
Yeah.
the, you know, she was tired, you know.
and they're very, you know,
So right now there is, I know I took my kids to the doctor and I was talking to one of the nurses and she said, you've got a 15-minute window and that's it. I mean, you go in.
oh, yeah, producer.
Right.
Okay, and so I was talking to another doctor, and you can chime in and tell me and he said that he has to see, I mean, he's required under his contract to see X amount of patients a
Exactly.
day.
Certainly.
Yeah.
I'm lucky.
Even now.
Yeah,
with
I'm lucky.
Even now,
Yeah,
yeah.
I'm lucky in that I don't have to do that, although you get frowned upon if you do certain things. You
Yeah.
know, if you don't do certain things, you don't see enough patients.
So under the Obamacare, do you think that will increase and you have to see
You
more
will, you will
patients?
probably, I think there will be, it won't be as noticed as it won't be as publicized as
Oh,
So it's going to kind of
no.
be
Yeah.
like just get them in, treat them, get them out. There's no,
Yeah.
you're going to totally lose
But
that
if you
patient-doctor
lose- but if you lose-
relationship.
Yes.
If you lose the incentive of not the money, I mean, you know, that's a big part of it,
Mhm.
yeah, not the money, but of how you want to practice medicine. I mean,
And how you feel
I
at
mean,
the
you
end of the
can
day.
love medicine, and I mean, I'm passionate about this, but you may not like the way you're doing it.
Yeah, because
And that
another
really
thing,
messes you up.
when you get such a, like I was talking about, you know, being a socializing place, so people don't think twice about, oh my, you know, I have this first. when a doctor sees something, oh, here comes another one with nothing, here comes I mean, it can, you know, even for them, they get a little bit bored and say, okay, I am another there, and sometimes they will miss something important because they are bombarded by
But it doesn't
people.
matter. It doesn't matter, Billy, because the thing is, if you work digitally instead of analog, if you just see results, outcomes, and all this, what you'll get on the average, you look great.
No.
But the things that may happen on either end are disasters.
Or that you don't
And those are the ones that are the most fun too, though. Yeah.
Let me ask this. I know when we spoke the other day, you told me, I don't like politics.
No.
I don't like it.
No.
Most people don't. Most people don't want to get involved in politics. They want to know as little as possible. Every couple of years they go in and they push some buttons and vote for some people. But is it important now that people become involved and educated?
Well, I tell you what, it's important that people become involved and educated in what's going on in politics. I think we need a lot of citizen politicians. I think that if enough people know what's going on, they're educated about it and all that, there will be some that I don't know if I got what it takes to become a politician, and that's where I take my hat off to you.
Yeah.
To want to pick up the ball and run with it when the field is so muddy. It's something to admire.
like
I never
to
thought
start
about it before.
Yeah, and I think when we go back, having had the experience of living in another totalitarian government, one thing is that the people in Washington count, and I want the people to understand, because the changes that have been so incredible in the United States that I don't think I'm living in the same place anymore, that the politicians in Washington, or the ruling class really, they are counting in the people's ignorance. They count on that.
A little bit of there, yeah.
to shove down their throats whatever they want. And believe me, having lived in those two governments, and you can say the same, if you look at Venezuela, you look at Cuba, the people at the top, they never miss a meal. They never miss the best healthcare in the world, because Castro has gone to Spain to get it, or wherever they need to go.
Right.
Same as the one in Venezuela.
Well, you're right. You're right.
They
have a separate healthcare.
Oh, so they are going to be in the tops, but
Yeah.
we need to take responsibility. Don't leave it to the military. We think that sending soldiers outside, we are okay. No, we need to do our part, the rest of us, to maintain the democracy, the freedom that we have.
To be educated, that was good. So in wrapping up then, Sarah, Dr. Marera, what are some things you see that we could do, that we could help change things without going to an extreme of socialized?
Don't ask me, I'm going to get burned at the stake.
Okay. Well, we don't want that out.
I'll answer then.
How about some good common sense things that they could
Personal
do right
accountability.
now?
Just number one, personal accountability. Understanding that when you get married and you have a family, you're responsible for providing to them, not the government. We should never, and it goes back to, we are a land of equal opportunity. Everybody has the opportunity to be successful. Everybody has the opportunity to work hard and to become educated and to chase their dreams. Now that doesn't mean that everybody has equal outcome. There's a difference between opportunity and outcome. And the difference is your work ethic and in how hard you work towards it. And I think we have created a generation of people that expect equal outcome based purely on existence. And we are not born into certain expectations of our life. We work for those things, and that comes back to personal accountability. And if we look to the government to solve all of our problems, every problem they solve for us takes a right away.
Yes.
No, there's many big problems that we have as a nation, especially a country with 300+ million people and 50 states, like I said, herding cats. If you have a big country like this, and like you said, you have to have accountability and responsibility, you have to, the government has only so many things, big problems that they could really work on, rather than every little micromanaged thing in our lives. There's rules and regulations for everything.
Yes.
Light bulbs.
And